I like it, I love it too, 'cause we're all covered, yes me.
Good morning, KPFK listeners, and happy Valentine's Day. Welcome to Healthcare for Us. I'm your host, Erica Ferriston, here with co-host Gina Viola. Together, we chair Healthcare for Us, a nonprofit, all-volunteer organization fighting for healthcare as a human right in California and the larger fight for healthcare justice. We bring you the latest on healthcare policy, expose how medical insurance is costly and deadly by design, and demonstrate how a single-payer healthcare system saves money and, more importantly, saves lives. Today, we're talking with California gubernatorial candidate Dr. Butch Ware about his campaign and how policies of love create thriving communities. Before we dive into today's show, please know that the views expressed on this show are solely those of myself, Gina, and our guest. They do not necessarily reflect the views of KPFK or the Pacifica Foundation. So sit back, tune in, and let's get the show started.
Single payer, it's what we need and what we deserve. We cannot say we love each other and continue to keep insurance companies in our lives. Single payer healthcare is the complete removal of the health insurance industry from profiting off of what wee bit of care it even manages to give us. Single payer removes the profit motive from our care. It decommodifies our bodies as a means to enrich CEOs so they can buy multiple yachts. We keep our doctors and the government pays the bill. CalCare, the bill we have for it in California, includes not only our medical doctors, but our dentists, our mental health professionals, our eye doctors, all of it. Single payer is love for community.
Yes, it is. And talking about love, we are so glad to have Dr. Butch Ware here today as our guest. He is a leading academic authority on U.S. Black radical tradition, Africa, and Islam. He is a professor of history at UC Santa Barbara. You all might remember he was the Green Party vice presidential candidate in the 2024 election, and now he is running for governor of California on a revolutionary agenda that includes, say it with me, audience, say it with me, Gina, what does it include?
Single payer healthcare.
A policy of love. So welcome, Dr. Ware. We are so glad to have you here.
It's an honor. Yeah, it's an honor.
Yeah. So before we get into, your campaign for governor and the policies of love that you have on your campaign, I would like to know, what was the feedback you heard across the nation about single payer healthcare, or Medicare for All, as it's sometimes called?
I mean, fantastically popular, policy, one of a number of policies, that neither Team Blue nor Team Red was capable of punching us on because of its, vast popularity with the American people. I really like the fact that, so the messaging that we used on the campaign was largely Medicare for all. You guys, just shouted out single payer healthcare. I really like the way that you framed it in the open. And I think that that's where we need to shift the conversation to actually just talking about this as healthcare as a human right. I think that it's absolutely, sort of critical that we understand this and that we actually make this not just a political question, but a question about our values, about our morals, and about our ethics. It is a moral abomination in a country that has this kind of wealth, and in the state of California, which has a gross domestic product of twice the next largest state in the union, right? That we would have people dying of diseases because they're afraid to go see a doctor because they don't know who's going to pay for it or if it's going to be paid for. It is a shame on us as a human family that we would allow people to have cancer diagnoses, essentially bankrupt people, when we know that these for-profit insurance companies are going to purge people off of the rolls so that they don't have to pay for the care that people have been paying their lives for, right? These quote unquote healthcare companies provide neither health nor care. These are extortionary companies. And they're like a bad Vegas slot machine. You pay in, but they don't pay out. They never cash out, right? And so we're in a situation now where I think that the language of single payer healthcare, it resonates with some, but you have to know a little bit something about the policy. Medicare for all, similar, although perhaps more accessible because people know a little bit about what Medicare is. But I think that the framing that you guys took from the outset, which is that we are talking about a fundamental human right, that's the language that we need to be using, and to make that right universally accessible in the state of California. Last thing that I'll just say off the open is that whatever we do here in the state of California is going to irrevocably shift the national conversation, right? California, if the states were all individual republics, would be the 5th largest economy in the world. And if we are able to, pass single payer healthcare in the state of California, then that's going to give us tremendous bargaining power with pharmaceutical companies, with all kinds of other medical negotiations that will essentially destroy the for-profit model, nationwide. If you look at what took place in Canada, right? I think it was Saskatchewan, one province, was able to successfully pass, single payer healthcare, and then that led to a domino effect. Which led to the spread of the institution across our neighbors to the north. So I think that what people need to understand really, that the California gubernatorial campaign that I'm running with single payer healthcare as a central issue, literally it is the top line item, on our campaign literature, in our emails, in our press releases, and so forth. That is the first step of transforming the healthcare environment in the United States of America as a whole. So it is a whole revolution that we are talking about, accomplishing here in the state of California. And we could have been done this in the state of California, right?
Yeah.
We could have been done this,
This last year.
Just this last year. And a number of times before, right? And the insurance companies have come out of the blue, to drop a bunch of money on, Democratic, lawmakers, despite the fact that, there's super majorities, that these folks could have passed these things at any point in time. But the reality is that the party that is in charge of making decisions in the state of California is in the pockets of the healthcare. Sorry, they can't see the air quotes on the radio, so I'll spell them out. But they're in the pockets of the healthcare industry, to the detriment of the health, safety, and security of the people of California.
Thank you so much. You are speaking our love language, Dr. Ware. You are just nailing it. Yeah, we call it the health insurance industry. So that's how we get around that. And I really appreciated your comment, because we, in the movement here, debate, struggle, what to call, single payer healthcare is an older definition, but people don't really know what that is. And, so I appreciate you bringing up, the Medicare for all, and then, people, my husband calls it, he said, you guys just need to call it free healthcare. Just like public school is free school, just call it free healthcare. So appreciate that. But let's switch gears or continue along the gear. Tell us about your campaign. You just, had an incredible candidacy as the vice presidential candidate for the Green Party in the 2024 election. What on earth is making you get back and go again? And tell us more about your campaign.
Yeah. So after, a lifetime of, public service oriented scholarship and organizing, I was minding my business, contributing to public conversations and organizational activities in the communities that I'm most, connected to, when I did a social media spot, an Instagram live with Dr. Jill Stein. And literally 24 hours later, in mid-August, I was invited to serve as the vice presidential candidate on the ticket. And we ran, like our hair was on fire for the last 2.5 months that I was on that campaign. I had 2.5 months essentially before election day. And one of the things that I perceived is that one of the critiques of the Green Party was, well, where are you guys between, presidential elections, right? And there's a disingenuous version of that, argument. People know that they're Green Party officials getting elected, and that's just a rhetorical strategy that's sometimes used to attack the Green Party. Having said that, I personally believe that I could not allow us to take the foot off the organizing gas, so to speak, politically, because of the urgency of the moment. And shortly after, the campaign ended, this problem of, healthcare extortion was, framed for us in the most dramatic of terms, with the public assassination of, United Healthcare's chief executive, and the overwhelming response of the American public, to a CEO being debrained in downtown, Manhattan, was celebration. And I think that tells you,
understanding.
And understanding.
Understood.
Everybody understands because, everybody is connected to someone who has been denied life-saving, life-giving care, just so that some CEO somewhere else could sleep on a pile of another $1 million, right? And this takes us to the heart of the issue, right? That the California gubernatorial campaign is a desire. It's driven by a desire, first and foremost, to win, to serve the people of California, and to actually take this fight to those corrupt politicians that are in the pockets of these big corporations. But it is also to extend this fight nationally. And what I've been trying to say, and the healthcare argument that I made off the top was part of this, is that if you are actually committed to transformational change in this country, then you need to get behind what we're working on here in California, because whatever we are able to accomplish here will, by definition, shatter the norms throughout the nation. California has this, reputation of being the most progressive state in the union. Well, let's test that hypothesis, shall we? Let us actually bring about responsible governance that is accountable to the people rather than to the corporations. I mean, Declaration of Independence, is all about, government by and for the people, not disappearing from the face of the earth. Well, it may not have disappeared from the face of the earth, but it for sure has disappeared from the United States of America, California included. Because what we have right now is government by the corporations, for the corporations, mediated by the corporations, in the interest of corporations. And the healthcare conversation is just one of these core places where, if we make a strategic intervention in the state of California, then we can shape outcomes for the nation at large.
Wow.
Ashe.
Well said. Yeah, Ashe. Quick station ID, you're tuned in to Healthcare for Us on 90.7 FM, KPFK Los Angeles, also streaming live at kpfk.org. This month is Fund Drive, and KPFK is your trusted source for independent, people-powered radio. Here at KPFK, we amplify the voices and stories that mainstream media often ignores. Dr. Ware, do you want to tell folks why it's important to support public stations like KPFK?
Because the corporate media, channels corporate interests and, floods our airwaves with propaganda around the clock. And if we do not support independent media voices, then we are deprived of a fundamental instrument in our struggle for collective liberation.
Yes. So right now, pick up your phones and dial 818-985-5735 or visit us, kpfk.org, and click on that donate button. We need you to donate today. We need stations like KPFK to be vibrant and alive so that it can bring you shows like this, Healthcare for Us, talking about single-payer healthcare, words you won't hear on any mainstream media. So once again, 818-985-5735. 5735. Tell them you're loving what you're hearing, Dr. Ware on Healthcare for Us, and pledge today. So heading back into our interview with Dr. Ware, we're so excited you're running for governor. And when folks were getting into the presidential race, Erica and I would often say, wow, if folks just ran on Medicare for all, they would win. They would win. Like, folks need this so desperately. So to see you pivot to this governor race is really exciting. And to see you putting single payer healthcare, at the top of the platform is super exciting, needed. I don't see how we get CalCare without it. So grateful for you doing that. Looking at your website, we're very excited. It doesn't look like regular gubernatorial websites. And you have mutual aid and direct action front and center. We love it. We want to hear more about that.
Yeah. So, I mean, there's a couple of pieces to that. The first thing is that I'm, proud, registered Green Party member running as a Green Party candidate, but our collective liberation is larger than any individual party. So that mutual aid and direct action component is meant to call people in from across the ideological spectrum, even across party affiliations, to do the work of building a movement of communal care. And as somebody that's like a lifelong student and teacher and exponent of the Black radical tradition, I'm really just drawing on the Panthers, right? Oakland's finest, who everybody gets obsessed with the armed police watch, but people forget that the first 6 points on the Panthers platform were all what they described as survival programs. And Black Panthers ran free healthcare clinics in cities like Chicago and other places, and essentially applied the pressure to our governmental authorities to fulfill their mandate for basic care. The Panthers made this argument that healthcare cannot be a for-profit industry lest we be deprived of this fundamental healthcare. And just pausing on the healthcare issue for a moment, right? We were tricked, not we, but some people were tricked by Reagan's trickle-down economic arguments. And the Democrats are now essentially a neoliberal party that does, for what I sometimes call DEI Reaganomics, okay? They just sprinkle some people of color into a trickle-down neoliberal model, which is privatize everything, okay? And the problem with that model should be immediately apparent and obvious to everyone. It was apparent and obvious to the Panthers, which is that if you put a toll booth in front of public goods, then private companies are going to prioritize their shareholders over their policyholders. They have to. That's what private companies have to do. So you are essentially mandating that your healthcare will either be inferior in quality or higher in cost, because you are inserting a rent-taking, profit-making class in between the people and life-giving services. So single-payer healthcare dramatizes that for everyone, but it is also the case for other services that have been increasingly sold off to the highest bidder by this duopoly, by this blue and red coalition of corporate capitalism. So we have to fight back by reclaiming these public goods, because it doesn't take a genius to understand that if the state were just to run such a service at cost, that would be a better solution for our healthcare outcomes than somebody taking a profit off the top of it. And then there's other pieces that people don't think about that actually have to do with like massive economic benefits, not just social benefits for the state of California. Right. I remember seeing a study that said that in the mid 20-teens, General Motors was spending more, and probably still is spending more on healthcare costs than on steel for its vehicles. Right. Just think about this for a second. So imagine the shift, the seismic shift that would take place if you have universal health care in the state of California. And that shift is going to be even more of benefit to small business owners, which is absolutely crucial, because right now, small business owners cannot be competitive when the Democrats are giving all of these tax breaks to monopolies and to wealthy corporations, and they're the only ones that have the economies of scale that allow them to carry employer health coverage. So it creates an environment where more of the wealth is funneled to the top, and our small business owners are choking. This would give, a competitive advantage to the state of California over the rest of the nation, and actually help to draw business. Another piece that's often forgotten is that right now, organized labor, our union movements, what do they spend most of their collective bargaining energy and activity on? Healthcare, right? So if healthcare is provided as a human right, then our organized labor movements can focus their attention where it needs to be focused, which is on wages and working conditions. So there's all of these ways in which, if we just take care of the basics, then there are going to be all of these secondary and tertiary benefits that will, matriculate down to the people of the state of California. And as we said from the top, California will, one way or another, set an example for the nation.
And this is why, we've been organizing for CalCare for several years. That is the true single payer bill. Ashkara brought it, the CNA authored it. We didn't have a hard time getting small businesses on board. How many did we get, Erica? 280, something like that. We did, we're starting to get unions on board. We have folks in the teachers union. Shelley Erkey is working with a group called Educators for Single Payer, and has brought along CTA, right, the teachers union. We have Hollywood for CalCare. Caroline O'Riordan is trying to organize unions, entertainment unions in. She's gotten IATSE. Still working on that SAG-AFTRA, but it's not a hard sell when you get into the room with the right people, right? So running on something like this in California feels like a winning platform to me for you. It's
a no-brainer. To be perfectly honest, it only is debatable if you are, weighing the corporate contributions of insurance companies against public benefits. As a Green Party candidate, we don't accept corporate, contributions, which is why, people need to donate to the station, but people need to put their money where their mouth is and donate to this campaign as well. Because the reality is that it is going to take resources to fight against these vested interests. But there's so much that is beneficial for us in it. I mean, right now, the reality is that taxpayers in the state of California are footing 70% of the bill for healthcare in the state anyway, right? It's just that we're getting a lousy service in exchange for, for footing that bill. And if you just remove that, rent-taking administrative insurance structure, the data that we had on the campaign is that, nationwide, and I think in California, it's actually a little north of this, 30 cents on every single healthcare dollar is essentially just spent on those administrative costs. That you've got entire, university hospital systems that have more administrators, administrating insurance than they have beds in their hospitals.
And you're seeing doctors demoralized by this. They can't even spend time in those rooms with their patients because they're busy administering it.
They cannot keep to their Hippocratic oath. They cannot practice medicine the way that they were trained to practice medicine, because they have to make all of these decisions essentially in a dialogue with insurance companies whose job it is to deny healthcare so that they can maximize dividends to shareholders.
So, Dr. Ware, we are coming down to time, and I'd like to take this moment to see if I could get a campaign promise from you. When you are elected governor of the great state of California, would you pledge that one of the first things you do in the first 100 days in office, would you go to the California nurses And I'm just going to say, it doesn't have to be Ashkara, but since he's been the one, and say, I
Yep.
want this bill. I want the CalCare bill. I want it running through the legislature, because I am ready to, make sure to vote that this passes. So that is my question. Do you make that pledge? And then my follow-up question is, and you only have like 30 seconds to answer, how do you make sure this happens as governor when you have a supermajority of Democrats that are on the take with, health insurance corporations?
We've been so close before, so that's the first thing to say. I mean, past it when Schwarzenegger, was governor, precisely because they knew that he would veto it, right? So this is a way of putting the Democrats, arms behind their back, twisting it, and making them, actually put their money where their mouth is. And the way that you make that happen is precisely by adopting this language of healthcare as a human right, and then saying to them, so you're saying it's not? Is that what you are saying, party that says that you are about defending ordinary people, oppressed communities, and so forth? Say right now that healthcare is not a human right. And I'm going to tell you this, is that if I'm in that position, and again, from your lips to God's ears, when I'm governor of the state of California, what it will mean is that we have survived the jungle, primary and finished in the top two, and we will have had the opportunity to vet our case publicly on debate stages, and that will put an enormous amount of pressure on these people to put their money where their mouth is. And if we win the gubernatorial mansion, then that means we will have a mandate from the people of the state of California that they cannot refuse, period.
Thank you. And I'm taking that as a yes. You will go to the
100. Yes. I'm sorry. I should have led with yes. Yes.
Can you tell our listeners what your website is?
www.butchwareforgov.com. And that's the number 4, butchwareforgov.com. And you can find all about the mutual aid activities, the gubernatorial campaign, volunteers. We've already had, I think we're north of now 300 volunteers registered just in the first 10 days. And when combined with the pledges and all the small donations we got, we've raised, I think, $111,000 in our first 10 days on the campaign. So we are about to build a machine here in the state of California and get this done.
Thank you for coming on today, Dr. Butch Ware.
My pleasure.
So we have a few upcoming actions. HC4US is always having general meetings and other ways to plug in with us. So please check out our website, hc4us.org, for all of today's talk. Our past episodes are there. You can find us on the socials there.
Yes. And again, I want to thank our guest, Dr. Butch Ware. Thanking Smiley Tea and the Tall Trees for our theme song, our board operator, Wendell Handy, Scott Peak, our tech operator, Dennis Resendez, Carol Fodera, and the entire Healthcare for Us team that makes this show possible. Healthcare for Us airs every Friday at 7:30 a.m. Next week, tune in to hear from your host, Taiji Miyagawa. And coming up next is Democracy Now! But remember, single payer is the solution. Join the healthcare
revolution.